topics and opinions expressed in the following show are solely those of the hosts and their guests and not those of W4CY Radio, its employees, or affiliates. We make no recommendations or endorsements for radio show programs, services, or products mentioned on air or on our web. No liability, explicit or implied, shall be extended to W4CY Radio or its employees or affiliates. Any questions or comments should be directed to those show hosts. Thank you for choosing W4CY Radio.
Welcome to the Ask the Expert show on W4CY Radio and Talk4 TV, where we bring you educational information from top local experts in the fields of legal, health, financial, and home improvement. Now sit back and listen to experts in family law, association law, hearing loss, business brokers, home care, along with many other topics. Now here are your hosts, Steve-O and Sophia.
Hey, good afternoon, Dallas. Welcome to another Ask the Expert show where we bring you the finest, and I do mean the finest experts in the Dallas-Fort Worth area. I got to tell you, I'm really excited about the show today because next month, enrollment starts for Medicare. And listen, if you were like me, I was so dumb when it came to Medicare, and we have the perfect people. Actually, just have one of the partners today, and I got to give a disclaimer because we've been reaching outside the Dallas-Fort Worth area. We do not offer every plan available in your area. Any information we provide is limited to those plans we do not offer in your area. Please contact Medicare.gov or 800 Medicare to get information on all your options. Let me introduce you to one of our favorites, Sharon Luker.
Hey, Steve.
Hi, Sharon. I am so glad we have you on because next month, guess what starts?
Wild, Wild West, Steve. Wild, Wild West.
And now, Lynn, your partner, couldn't be with us today. We hope everything is doing well with her. But Sharon, I got to tell you, we just had one of our listeners tell us they talked with you and she thought you were adorable. Are you adorable?
I'm the best.
So, Sharon, first of all, we're talking about Medicare. Tell people about your background and your company.
Okay, so I am part of Your Medicare Gals. Lynn Tim, like Steven said, couldn't be here today. She actually sold a house and is buying a house and is moving. So it's exciting things for her. Here in the Dallas-Fort Worth area, if you live in this area, houses are going. Her house sold in 3 days, Steve. 3 days.
No.
And she had to be out in 2 weeks. I mean, it's just, woo, it's fast. But Lynn and I have been in the business. I'm a little older than Lynn, and I've been in the business, 15 years, 20 years. I am on Medicare. I know how it works for me. That's how I learn a lot. And I have my own practice. Lynn has her own practice, but we formed Your Medicare Gals to work collectively together, kind of to be a local resource and now a national resource for anyone that has questions on Medicare or really needs help enrolling in any plans.
So, Sharon, if somebody's listening right now has like a relative, a mother or a father that are in another city or state, they can still call you?
They can still call me. Do understand, though, that the way insurance works, I'm an insurance agent, by the way, and the way insurance works is you have to be licensed in any state that you talk to someone. So I'm licensed in probably at least 20 states, I would say. So if we get a caller from someone we're not licensed with or in that state, Lynn and I both have a lot of connections that we can refer you to someone just as good as we are. So we work all over the country.
Sharon, do you hear the bells going off in the background?
I do. It's
these are people who want to know when enrollment starts.
Okay. Here we go, people.
Yes. Let's do it.
Okay. So that is what we're going to talk about today is annual enrollment. I'm already getting calls. We're already seeing commercials. So let me lay this out for you. We as agents already see the new plans for
Oh,
2024,
that's right.
but we cannot tell you. We cannot talk. Mum's the
You're,
word. So don't
you're a
call the
tease.
agent. Don't call me and go, tell me what's going on.
You're a
Now,
tease.
but starting October 1st, I can now reveal the plans that have come out from the different carriers. So that's the day that you can start talking to me or Lynn or your agent or go online. They're starting to be revealed.
Next
Now,
month's show.
pardon?
Next month's show, we can talk about it.
Yes, exactly. Exactly. Because even though I can talk to you about the plans, I cannot sign you up for a new plan until October 15th.
Right.
Okay. So it's October 15th is the start date. You have until December, that's 12/7, December the 7th, in order to sign up. If you miss that day, you're dead. Okay.
Yeah.
They're pretty strict about it. There are circumstances throughout the year where you may be able to sign up. Those are special election periods, and we can talk about those later. But one thing, Steve, that I want to point out, because I'm already getting those calls. If you are on a Medicare supplement or a Medigap plan, or your card that you have does not say Advantage, or you see something that says Plan G or Plan N, you are not subject to annual enrollment. You do not need to do anything. You do not need to do anything. Your plan will continue to roll as long as you pay the check, as long as you pay the premium. You can change your Medicare supplement plans any time of the year. So let's say 4 months from now, for whatever reason, maybe you got a rate increase. For whatever reason, you don't like your Medicare supplement plan, you can call Lynn or I, and we can attempt to see if we can get you a better deal or change plans. However, if you're on a Medicare supplement plan, most likely you're also on a drug plan, Part D drug plan. They are subject to the annual enrollment. Okay. This is the only time of year, starting October 15th, that you can change the plans. Also, if you're on a Medicare Advantage plan, and if you don't know if you are or not, take your card out and look for the word Advantage. And if
Uh-oh, I'm
you're
looking
on
at mine.
you look at
I'm
yours,
looking.
it should say
Oh,
Advantage on it, Steve. If you're on Advantage plan, this is your time of year starting October 15th that you can change plans. And you should look at your plans, okay? Steve, have you gotten anything in the mail yet regarding your plan?
nothing.
Oh,
Mine is
really?
Humana. I've got Humana Gold Plus.
Okay, that's an Advantage plan.
Okay.
Does it say Advantage on the card?
It doesn't say that.
Well, isn't
It
that
just
interesting?
says Humana Gold Plus HMO.
Oh, okay, that's the key. That's another key. If it says HMO or PPO, that means that's an Advantage plan. So you have an Advantage plan.
Okay.
So this is the time of year. So I've already gotten for my drug plan, I've already gotten, the annual notice. We call it ANOX, the annual notices of the new plans, where it'll tell you the new premiums. It'll tell you the new coverage coming out for that plan. So everyone who's already on a plan should get something in the mail.
Sharon, do you like the new plan? Can you say that much?
I have to be very careful.
Yeah, I'm sure.
Let me say this. The Advantage plans every year are getting better and better and better.
They are.
And more doctors are taking them. That used to be the problem. Doctors weren't taking the plans. Hospitals weren't taking the plans. And by the way, not all hospitals take all plans. Not all doctors take all Advantage
Right.
plans. Okay. And every year, so you need to know on your Advantage plan that it goes from January 1st to December 31st. It only goes for 1 year.
Okay.
And they come in an annual enrollment, what's happening now, and they can change your plan. They can remove drugs off your plan. They can change co-pays. They can change your max out of pockets. It can get changed completely. So you need to look at it.
Wow.
Yeah.
I've noticed, Sharon, I went in for glasses and my
Yes.
doctor said, well, you probably have money on your plan. I didn't know anything about it. It turns out I had $3,000 on my plan for eyeglasses or hearing aids. But I
Yes.
didn't even know about it, though.
Well, this is shame on you. Shame on everyone. The information that the plan that the insurance company sends you every year tells you all about that. But what you can do if you're working, and this is why you want to work with an agent, okay?
Yes.
Yes, because you call the agent up saying, okay, so this is what I'm going to be dealing with. People are calling me up and go, okay, the new plans are going to be out. Am I on the best plan? It really depends on you. It's going to
Right.
depend on your medications, your doctors. I'll be asking you what's new in your life. This is a little bit of time to catch up, but you really do. Your agent will go over with you, the plan details, what you have. It's a lot and they vary. And different plans with the same insurance company vary. Like you're on the Humana
Wow.
Gold. Well, the Humana PPO will have different features than that Humana HMO.
Right.
So it's confusing. I don't know how anyone gets through this without an agent. I just don't.
You're absolutely right. And you know what? You got to, not only do you have to have an agent, but I'm going to tell people this. You need an agent like Sharon and Lynn. And I'm going to tell you why. Because I have an agent, one of those friends,
We all
supposedly.
have those,
And,
don't we?
yeah. And I find out there was so much that he didn't tell me about. And like sometimes, Sharon, I'll tell people I'm an HMO, and they go, "Why didn't you get PPO? You won't
Right.
like doctors." But I do like the doctors that I've had in my HMO plan, and I'm happy with it. But there's people who want PPO though too.
Well, so Steve, on the HMOs, why you hear that is a lot of people like their HMOs, and there's a lot of bad press out there. But you have to understand the restrictions. So, on many, not all, but on many HMOs, you need a primary care physician that
Yes,
you need to get a referral. So, if
yes,
you need to go to the cardiologist, if you need to go to the endocrinologist, you have to go to your PCP. That's buzzwords for primary care physician. You need to go to your PCP first and get the referral. With PPOs, you don't have to do that.
right.
And people don't like the restrictions.
Wow,
The good thing about the HMOs is because of some of the restrictions, you have better benefits. You have lower max out of pockets than you do with the PPOs. You
yes,
know, you as an individual have to decide. You got to pick your poison. You know, um,
right. I was
and
in the
so
hospital a week ago, and it's like one of the first times I've gotten out of the hospital. They didn't ask for one dime, not one
really,
dime. And I'm not used to that. I'm used to, well, your deductible, everybody's got a different plan, and I don't remember really the last time I paid for uh, any of my subscriptions. I mean, my prescriptions. So I like my plan. You're right. You do have to call your doctor, but mine makes it pretty easy. But you need an agent. You need an agent like Sharon, because there is so much out there that you cannot do this on your own. I don't think
well,
you should.
and Steve, you have to be careful because your doctor may take the plan now, but may not take it next year.
That's true too. Yeah.
Oh,
Oh yeah.
and so if you do not make that change, if you want to see that doctor next year, you're going to have to write a check. It will not be free anymore. Okay.
Oh,
Doctors
you're
got
giving us
pulled
away some
out.
of the information. You're giving out some of the information.
I
I'm
know, I
kidding.
know. And this is just the tip of the iceberg, because
Oh,
the other thing I want to bring up is drugs,
okay.
medications. Um, the plans, your drug plans, your advantage plans, at this time of year, they change formularies. Okay. So what that means is that's the list of drugs that they will cover in one of their tiers, tier 1, 2, 3, or 4, one of their tiers. So, one, you want to make sure that your drug is still being covered. Okay.
Right.
Two, you want to see if they switch tiers on you. You haven't paid anything for your drugs, because I can guarantee you they've either been tier 1, tier 2. And
Yes, you're right.
but they can flip. They can go to tier 3. Now you're in a larger copay. Now you may have to pay more out of pocket. Carrier number 1 may put it in a tier 3, but carrier number 2 may put it in tier 2. So you won't pay for it if you're with tier 2, but tier 3. And the other thing you want to look at is your pharmacies. The plans, drug plans, as well as the advantage plans, have favorite pharmacies, preferred pharmacies.
Oh,
If
I didn't know that either.
Yes, if you go to a preferred pharmacy, you'll get a better deal. So you could have the same drug, the same plan. You could go to Walgreens and you could go to CVS, and you will pay two different prices
Wow.
just
Did not
because
know
of the
that.
pharmacy. You want to know who your preferred pharmacies are with your plan. And it changes. Some of these are all combining, like CVS bought Aetna probably about 2 years ago. So, they're kind of in bed with each other.
Wow.
So you want to check the pharmacies, the doctors, there's a whole list.
Wow. This is
You're speechless, aren't you?
well, it's like I'm thinking we have a lot of older people who watch and listen to the show, and they might be freaking out now, what's in store. But we'll
Well,
have it on your show next month, though.
well, I am here to serve. Lynn and
First
I
of
are
all,
are here
two
to help.
people want your phone number. Now we're running on the screen, so these must be radio people. Tell people your phone number.
It's 972-596-1318. So Lynn and I, and the good agents, we have lots of clients who are extremely busy at this time of year. Okay. So, excuse me. So how you can make this simple for us. When
Oh,
you
good.
call me, I'm going to cut to the chase. Okay. I want to know, what do you have right now? Okay. I want to know the list of your medications. What do you take exactly? I want the right spelling. I had someone give me a list. I couldn't find the drugs because she had misspelled them all. I was trying to guess at the drugs, how much you take, how often you take it. If you're on an as needed drug, like an inhaler, I want to
Mhm.
know, how many inhalers do you fill your prescription every year? Do you get 2? Do you get 5? Do you get 10?
Right. Yeah,
I,
that's important.
I want to know your current doctors. Okay. Maybe you now have a cardiologist. Well, we need to make sure that cardiologist takes the plan that we see. I also want to know the hospitals that you would go to in an emergency that are around you. I want to know, if the ambulance came to your house, where are they going to take you? Where are you going to tell them to take you? Because if you're on an advantage plan, you don't have to worry about this. If you're on a Medicare supplement plan, that's the advantage of the med sup plans. You don't worry about any of this. But if you're
Right.
on an advantage plan, you want to make sure that the hospital takes it. Now on that note, if you go to a hospital that does not take your advantage plan, if it's an emergency, and that's defined a couple different ways, but if it's an emergency, then they have to cover you. But you don't even want to mess with that. You want to make sure you've got a plan. And you will know in certain areas, like in Florida, there's certain plans that are the big boys, everyone seems to take. The other thing I want to
Isn't
tell
there
you,
something, Sharon, if you're out of town and you're on, like, I think, like, if I'm out of town, I have to pay if I have to go to a doctor when I'm out of town. Is that right?
well, yes and no. It depends on your plan. So
Yeah.
that's another thing I want to know. Do you travel? Because some of
Yes.
the advantage plans, especially the larger carriers, have what they call a travel benefit now. So what that means is if you're on an insurance company A and you're in Florida or Texas and you go to Colorado, if that plan has a travel benefit, what that means is you could go to a doctor in Colorado who also takes the insurance carrier's plan. It'll be treated just like you walked across the street. Okay.
Okay.
And so that's why the large carriers have it, because the Humanas and United Healthcares and the Aetnas and they are all over the country. You get your regional plans like Blue Cross Blue Shield. It is that way only in the state, not necessarily out of the state. So that is a key feature when you are choosing a plan. But don't assume if you go out of your county, because these are county driven, by the way, county driven. So if you walk across the street to a different county, they may not offer the same plans that
Well, you're in Dallas, so Dallas County could be different than Collin County?
Absolutely.
Wow.
Happens all the time.
Wow.
So it is key. I know the county. That's one of the things I want to know. I want to know the county. I really want to get to know you and who you are and what your feelings are. Lynn and I walk in. I don't have any preconceived ideas. I know what I like for me, but that doesn't mean that's right for you. So I need to get to know you as a person, and I will tell you which plans I think are best for you. We talk it out. I spend a lot of time with people. We talk it out. We talk about the different plans, and once we narrow it down, then I can focus in on what we should do.
Well, once we've only got a minute left. Please give everybody your phone number and your website.
Okay, so my name is Sharon. My phone number is 972-596-1318. Our website is yourmedicaregals.com. And you can go on that website and you can fill out the drug form. If you want to fill out the drug form and then it'll get sent to us, then we will already have it. Or if you want to set up a meeting, fill out the, hey, I want to meet with you type thing. It's probably easier than, and I'm an email girl. I do emails all day long. Okay. I mean, I text, but I'm emails,
Well, because this is so important, I haven't even shared this with you yet. Next month, we are going to be replaying the October show for them in our San Antonio market and our Houston market. We're going to replay your show. So everybody will know. We've only got a minute. Sharon, thank you so much. We'll see you again next month.
Bye.
Thank you, Sharon. And we'll see you next week with more Ask the Experts. Stay cool. We'll see you soon.
Thanks for tuning in today to the Ask the Expert show on W4CY Radio and Talk4 TV. Tune in next week and every week to hear more from our experts on personal injury, insurance, air condition repairs, estate planning, Medicare, and many other topics in the areas of legal, health, financial, and home improvement. See you next week.